So how do we actually give a medication? Well, the first step is to obtain an order. So you have to have one, and this could be a standing order. This could be a verbal order. Maybe you called a doc on the radio and got a verbal. Or this could even be a written order. Maybe you're doing a transfer from one hospital to the next, and the patient needs to be kept on a continuous nebulizer. That would be something that's outside of your normal standing orders, but it's something that is not outside of your scope of practice, really. So you could have a written order for something like a continuous nebulizer. So the next thing to do is confirm the order. And if you have a standing order, the best way to do this is to just double check protocols. If it's a verbal order, you want to repeat it back. And if it's a written order, then you're going to double check what it says, and you're also going to confirm with the writer. So confirm with the doc who wrote it. Make sure you can read his handwriting or her handwriting. You want to select the proper medication, so pick the right one. This seems silly, but a lot of the medications come in very, very similar packaging, and sometimes the labels are even hard to read. The other thing that's happened sometimes and caused medication errors is that 1 week you have an albuterol ampule that looks like this, and the next week it's got a nice big A on it there, and the next week it looks more like this, you know, and it doesn't have an A on it, and it says something different on it, and you don't really know, is this the same medication? I don't know, the supply guys ordered something different. So you always want to check and make sure you pick the proper medication. You want to avoid contaminating your medication or others. Check the expiration date. Check for signs of contamination like discoloration, cloudiness, or particulate matter. The next step is to verify the form and the route. This doesn't get to be too big a deal as an EMT, but when you get to being a paramedic and you give one medication 3 different ways, you have to verify that you're giving it the right way. Then you have to inform the patient of the order. So communicate with your patient. Talk to him. Tell him, what are you going to do? Hey, look, I have this order to give you an albuterol nebulizer treatment. So here's what I'm going to do. I'm going to put this on your face, and it's going to blow a lot of air in your face, and it's going to blow some medicine in, but it's going to help you feel better. Then you want to double check the medication. You want to check the expiration date again and for contamination again. And this seems silly, but what happens when we're in the middle of taking care of a patient is we tend to take and put things down. We'll set it down right there, you know, on the bench seat in the ambulance, and then we'll go to pick it back up, but we didn't notice that there are 6 other things that our partner left out, and we'll grab the wrong one. So practically speaking, if you put something down, double check it to make sure you pick up the right thing. For testing purposes, when we do test you on medication administration, you do need to double check it at least 2 more times after you check all that stuff initially. Assess the patient prior to administration of the drug, and then administer the correct dose by the correct route. Dispose of any contaminated equipment in an appropriate container, and reassess your patient again after administration. The 4 rights of medication administration. We want to make sure we have the right patient, the right medication, the right dose, and the right route. Now, this may seem really kind of silly. Is it silly? No, it's not silly. This isn't silly, and the reason that it's not silly is that most of our errors in EMS come from medication administration. And it's so easy to make these mistakes when you're in the middle of taking care of a patient, especially if you put something down and pick it back up and put it down again and then pick it back up, or your partner's driving the ambulance and bounces you around and the medication suddenly flies out of your hands, so you have to get a new one, and then you just forget to check it again. but don't forget to check it because we don't want to make any medication errors. So I mentioned that your patient needs to be assessed before and reassessed after administration. So you want to do a quick physical exam of whatever the area is that your medication is trying to impact. So if you're giving albuterol, for example, that affects the lungs. So you want to do a physical exam of the lungs. So that means looking at the chest. Look at the chest, abbreviate that CX. So look at the chest. Look at breathing. Listen to lung sounds. And then generally ask, how does your patient feel? You'll do vital signs, so blood pressure, heart rate, and respiratory rate. And of course you report rate, rhythm, and quality for those two. And then look for change in patient condition with the medication administration. Keep in mind that a return to normal vital signs may not indicate improvement. You have to assess your patient and not just look at the numbers. So these are the medications that you're responsible for knowing. And these will come up based in different times throughout the course, depending on what they treat. Aspirin, activated charcoal, albuterol, epinephrine, oral glucose, oxygen, and nitroglycerin. So these are all medications that you're responsible to know. And you'll need to know the dose, the indications, the contraindications, and how they work, the mechanism of action. You need to understand why we're giving them to these patients. Well, that's it for this lecture. Thank you for paying attention, and if you have any questions, bring them into class.